Let's talk about depression, the Western medicine view. The main categories of mental illness mentioned in the classics are as follows. Lilium syndrome, this is mentioned in the essential prescriptions of the Golden Cabinet. Depression, Plumstone syndrome, agitation, palpitations and anxiety, manic depression, hysteria, cretinism. Depression, as defined in Western medicine, has aspects of the first five ancient disease categories. Lilium syndrome, depression, Plumstone syndrome, agitation, and palpitations and anxiety. Depression is the most common mental disorder in the population. It is twice as common in women as in men. At a global level, it affects 4.4% of the world's population and represents one of the leading causes of disability worldwide. So here is the correspondence between Chinese mental emotional conditions and depression in Western medicine. If compared with other mental health conditions, for example, anxiety disorder, it shows a wider variation in age of onset. The peak risk period for onset of major depressive disorders ranges from late adolescence to the early 50s. A depressive illness is primarily characterized by a change in mood consisting of a feeling of sadness that may vary from mild despondency to the most abject despair and may cause symptoms such as indifference, apathy, or irritability, usually accompanied by changes in sleep patterns and weight, loss of appetite, lack of energy or psychomotor agitation, feelings of fatigue or guilt, and thoughts of suicide. Some diagnostic criteria must be met for a major depressive disorder to be diagnosed. Severe criteria of a major depressive episode, according to ICD-10, are the episode must last at least 2 weeks and cannot be attributed to the abuse of psychoactive substances or to an organic mental disorder. General criteria, presence of at least 2 of the following symptoms: depressed mood, loss of interest or pleasure, lack of vitality, or increased fatigue. Presence of 1 or more symptoms of the following list so that the sum total is at least 4:1. Loss of confidence and self-esteem, feelings of excessive guilt or inadequacy, thoughts of death or suicidal behavior, decrease of the ability to concentrate, changes of psychomotor activity with agitation or inhibition, sleep alterations, changes of appetite with corresponding weight change. The ICD-10 divides major depressive episodes into mild, 2 or 3 of the symptoms of criteria B are present, moderate, at least 2 of the symptoms of criteria B are present, in addition to symptoms of criteria C. Until there is a minimum total of 6 symptoms, or severe, there must be 3 symptoms of criteria B in addition to symptoms of criteria C until there is a minimum of 8 symptoms. Depression may be accompanied by the so-called somatic symptoms: amenorrhea, loss of libido, psychomotor retardation, restlessness, and constipation. People with depression usually experience worse symptoms in the morning and tend to wake up early. Some people find it difficult to get a correct diagnosis of depression. Therefore, considering the global high prevalence of this condition and its remarkable impact on quality of life, it is important to administer the patient health questionnaires 2 and 9 as appropriate screening tools to the general adult population. In distinguishing the normal reaction from pathological depression, a quantitative judgment has to be made. If the precipitant seems inadequate, the depression too severe and too long-lasting, the condition is regarded as abnormal. In addition, the severity and incapacity in depressive illness differs qualitatively as well as quantitatively from depressed feelings that are part of normal experience. When making a diagnosis, other conditions that may cause depression should be ruled out, such as chronic diseases and the abuse of drugs or other illegal substances. In elderly patients, depression may present with symptoms that mimic dementia, and these individuals have a high suicide rate. The findings of twin studies have demonstrated evidence of a strong genetic component for early onset depressive disorders before 25 years, which could modulate the response to stressful events such as the death of a close relative, an act of aggression, or serious relationship problems. Nevertheless, mechanisms associated with the pathogenesis of depression have yet to be completely understood, and it is estimated that only 50% of the patients respond to drug treatment.